I'm Tammy Durant. I'm a family physician. We are kind of the first stop for most people. Anything from the common cold to an ear infection to chronic heart disease, diabetes, high blood pressure, we kind of run the gamut. If someone has chronic medical issues that they have to see a specialty for, a lot of times we are the person who helps coordinate care. So that's kind of one of the nice things about family medicine is we are kind of the organizer of all the care. And I think patients appreciate that because they know that they have one place that they can go. We know them, we know who they're seeing, who their specialists are, what kind of care they're receiving, and we kind of are the coordinators of all that care. I wouldn't say that I specialize in anything specifically, but I do enjoy women's health and pediatrics and adolescent care, but certainly I enjoy all aspects of family practice as well. I work with my patients, especially if they want to try, alternative treatments or different medications and whatnot. I feel as long as we get to the same endpoint and it's a safe way to do so, that's the most important part. In communicating with patients, of course, everyone's a little bit different. Some people are more outgoing than others, so I try to give them more open-ended questions, and I think that if I do that, rather than doing yes and no questions, gives them a little bit more opportunity to kind of tell their story.
Drove 6 hours another way, then we got to the wedding, and now I'm at work, and of course deadlines.
It's helpful if they bring a list of questions, so then that way they're not leaving the office and saying, oh gosh, I really wanted to ask her that and I totally forgot. I think that makes the visit more productive if we get everything addressed at the same time. Having a young child at home, I think it does help my practice because even though from a medical perspective, treating kids, obviously we have a lot of training, but I think it gives me more of a practical approach to parents as well, and just tips from having a baby at home saying, okay, I tried these different things, this has worked, you can try this. So I think it is very helpful actually. I do enjoy golfing, but with having a newborn, it's a little bit tricky, so someday I'll get back into that a little bit more than I have been recently. I try to cook. I'm not the best cook in the world, but I try. I'm kind of an avid runner. I'm actually doing a race this weekend. But one of the things that I think patients enjoy about the clinic is that when they come to see me for a visit, they typically see the same people. So I have my own nurse who people get to know and they're comfortable with. The support staff gets to know them as well, gets to know their name, and I think that makes them feel more comfortable so they don't feel like they're lost in a big clinic and seeing different people every time that they come in. I think the thing that gives me the most satisfaction of being a physician is seeing patients grow up, meaning that if I'm following somebody who's a newborn and just kind of watching them grow up, go off to school, and teenagers going off to college and then getting careers, getting married, I think that's really fulfilling. Just seeing how people hopefully take my advice and make positive changes to their life, and they get really excited, and it makes them feel good, it makes me feel good. So I think that's probably one of the more fulfilling things of being a physician.